Good afternoon. I'm Sam Hawgood, Chancellor of UCSF, and it is my honor to be with you today to celebrate the life and accomplishments of UCSF's third Chancellor, Chancellor Phillip R. Phil's early advocacy of free healthcare and affirmative action forged a path that he followed throughout his career. His service under 2 U.S. presidents impacted public health on a national level. Phil, a physician by training, was a pioneer in health policy research. And as Chancellor, his work on the expansion of the biomedical research enterprise propelled UCSF into the health sciences juggernaut it is today. His commitment to justice persisted in his vision of a multidisciplinary research program that could not only address the racial and ethnic disparities of access to care, but the quality of that care. His vision led to the establishment of UCSF's health policy program, soon growing to the institute that we know today. At UCSF, his legacy lives on through the Phillip R. Institute for Health Policy Studies. And as we forge ahead, we are buoyed by the future of the institute under its new director, Joanne, and we will be inspired by Phil again and his commitment to a more just society, by his ability to lead by example, and we will discover fully what a blessing Phil was to us all.
Today, we celebrate the life of Phillip R. a remarkable man who made major differences in so many health spheres that it is almost beyond belief. It won't be possible today to highlight every accomplishment in the rich mosaic that was Phil's life. But we will look back on a set of achievements and reflect on his legacy that continues today at the UCSF Institute for Health Policy Studies. Emblematic of Phil's national stature, I'm delighted to welcome Speaker of the House, Nancy Pelosi, to share her thoughts about Phil's career.
It is a personal and official honor to join colleagues, friends, and loved ones, especially Roz, of Phil Lee, to celebrate the extraordinary life and the innumerable contributions that he made to our city and nation and the world. Phil was a trailblazer, a brilliant physician, and a tireless public servant. Above all, Phil was a champion for equality who understood that healthcare was a right for all Americans, not just the privileged few. Phil's commitment to enhancing the quality and accessibility of healthcare for all, particularly in our most vulnerable communities, was a significant force in creating Medicare and Medicaid, pillars of health and economic security for millions of Americans. During his decades of service to San Francisco, I saw firsthand Phil's commitment to lifting up underserved communities, tackling the scourge of HIV/AIDS, and building a healthier future for all San Franciscans. As Chancellor of UCSF, Phil's dedication to education and mentorship empowered the next generation of leaders, innovators, and health policy professionals. Today, the Phillip R. Institute of Health Policy Studies is a powerful tribute to Phil's legacy of valued leadership and bold vision. Its groundbreaking research and policy initiatives will continue to enrich and strengthen our community and the world for generations to come. May it be a comfort to his wife, Roz, his children, Dorothy, Paul, Margaret, Theodore, Amy, and Dusky, and the entire Lee family, that so many continue to mourn their loss and pray for them at this sad time.
Hi, I'm Peter Lee, and many people know me as the Executive Director of Cover California. But more important, I'm Phil's nephew and a member of the Lee family that sort of follows in Phil's footsteps. So like many of my cousins, my grandfather, when I was about 20, said, "Pete, why don't you become a doctor? Just like all of my kids, my 4 boys and a girl." I said, "Well, Grampy, I think I can do more for healthcare and health policy by changing laws and trying to affect the policy environment. And I was able to hold up an exhibit, which was Phil's book, which he came out with when I was in high school on Phil's Profits and Politics. Well, like many people in my family, we've been committed to public service. Phil was committed to public service, not just because of his dad, Russ, but because of his mom, Dorothy. Dorothy, my grandmother, was a suffragette, believed in social justice, believed in early childhood education. And Phil grew up as a child thinking about making America a better place. He carried that through his entire career, always thinking about how to serve, how to make America more just, more fair. And that's something that I think inspires not only his family, but people that he's been a mentor to across America and that we've all benefited from.
I'm so grateful for the chance to add my voice to all of you celebrating the remarkable life and legacy of Phil Lee. He was a brilliant, compassionate doctor who believed that healthcare is a fundamental human right. And he worked tirelessly to make it available to every American, especially the most vulnerable people in our society. Hillary and I were both so grateful when, working with Donna Shalala, we were able to convince Phil to come back into federal public service for his second stint as Assistant Secretary of Health. By that time, he was already a legend of public health service circles for his important role in the creation of Medicare, and especially for crafting the rules that hospitals had to desegregate in accordance with the Civil Rights Act if they were going to receive federal funds. That's exactly the kind of bold, justice-oriented approach to policymaking we were looking for then as we set out to reform America's health system. Our first meeting with Phil at the White House in 1993 was supposed to last about 10 minutes, but instead we wound up talking for more than 2 hours. He was a joy to be around, and we valued not just his knowledge, but his great sense of humor, his boundless optimism. And it pleased us that we often saw him at Foundry Methodist Church, which was, I believe at the time, the most inclusive Methodist congregation in the city. Phil's North Star was to give voice to the voiceless, to remove every barrier he could for every child. Whether in his advocacy for eliminating disparities in healthcare for Blacks, Latinos, and especially for Native Americans, for getting rid of discrimination against those with HIV/AIDS, to make it easier for Americans in rural areas to access care. He wasn't satisfied until measurable progress was achieved. We may not have passed Medicare or Medicaid when I was president, but we did succeed in reversing the decline in the number of people without insurance, getting vaccinations for children up to 90% for the first time in history, and really taking on things like Native American health. Phil was so pleased, I remember when we had all the tribal leaders on the White House lawn for the first time since James Monroe. He didn't last quite that long, but he went a long way back, always thinking forward. I will always be grateful for the fact that he was willing to mentor other people, young people who shared his passion for policy and for people. I'll never forget when he had his farewell party that he was all too happy to have all the rest of us pat him on the back, but the thing he really wanted to do was to prove to Hillary he was a better dancer than I was. And he did that too. So as you remember Phil's life and celebrate his legacy, my thoughts are with Roz, his children, grandchildren, and great-grandchildren, and all those he worked with and inspired over the years, including Hillary and me. And most important, with all the people who may never know who he was, but whose life are better now because of his extraordinary work. He was a national treasure. Godspeed, friend, and thank you.
Our first panel covers Phil's service to the nation. Beyond helping President Johnson implement Medicare and Medicaid, Phil played many other roles in shaping national health policy and health, such as chairing the Physician Payment Review Commission. With us to reflect on this important aspect of his career are Phil Caper, Dick Trudell, and Helene Lipton. Phil, in the 1970s, you served as a physician on the staff of Ted Kennedy's Senate Labor and Human Services Subcommittee on Health. How did you learn about Phil's work, and how did that influence you?
Well, Phil actually had a tremendous influence on my career trajectory, such as it was. And I first heard of him when I was an intern, Steve, together with you at Boston City Hospital. And it was 1965, which was the year Medicare and Medicaid were enacted. And Phil was Assistant Secretary for Health at that time. And he was a role model for me. He convinced me that it was possible for a physician to occupy a meaningful role in the formation of public policy, something I thought was critical.
We'll turn to Dick now. As a prominent legal leader in Indian country, you played a major role in establishing the American Indian Law Association, as well as serving as executive director of the American Indian Lawyer Training Program, and helped to create the American Indian Bar Association. When you worked in DC, you, then First Lady Hillary Clinton, and Phil conducted listening tours across many tribal areas. This led to important actions aimed at improving the health of American Indians. What was that like?
Well, first, let me say that it's an honor to participate in celebrating Dr. Lee's life and the opportunity to share some personal perspectives or remembrances and thoughts about our friendship. It was a privilege to really be around Phil. And the longer I was there, I started to learn more about his accomplishments and the fact that he had been the first Assistant Secretary for Health and then had a chance to do it again under the Clinton administration. In 1993 is when I first met Phil through First Lady Hillary Clinton. After we had that trip to Nebraska and Montana with the First Lady, Phil had asked me to help him. And I was thinking, well, I'm a lawyer. I'm not in the healthcare, working with healthcare professionals, what have you. But what he had an interest in, it was he knew I had the ability to pull people together. And so we embarked on really pulling together some regional conferences where we collapsed the tribes in the different regions to spend a day with Phil in terms of them laying out some of their concerns and their hopes. And after those, I think, 4 regional meetings, Phil was able to see just about every tribe in the country. And then we ended up doing kind of a session at the end in the U.S. Senate with Secretary Shalala. The purpose of those meetings was to really expose the concerns of tribal leaders and healthcare professionals in terms of their lack of access. The fact that, I think you've all read, especially in light of the pandemic and what has happened with the Navajo reservation. And it was good to see UCSF send some people down to assist. But what it did was really kind of illuminated the lack of access for some to meaningful health care. So it was a very good journey with Phil.
Thanks, Dave. Helene, you're a sociologist, an expert on drug policy, and a professor of health policy and pharmacy at UCSF. You and Phil wrote a book, Drugs in the Elderly, Clinical, Social, and Policy Perspectives. Helene, how did you come to work with Phil on these topics?
In 1974, Phil and Milt Silverman published a book called Pills, Profits, and Politics. The book received a lot of rave reviews because Phil and Milt called for national drug insurance. They were way ahead of their time because, after all, Medicare Part D didn't start until 2006. Phil and Milt also created a new branch of health policy research, drug policy research. And the book that they wrote was the first example of this kind of innovative research. So when I joined the Institute for Health Policy Studies, Phil asked me if I would partner with him in this new area of drug policy research that he and Milt had created in their famous book. And my response was a resounding yes. And we continued our collaboration for 15 years.
Well, thank the three of you for showing us how you met with Phil and how your paths crossed. I'm going to give you a chance now to reflect back on some other things. Phil Keeper, what was Phil Lee's influence on your career?
Well, it was most importantly that a physician could be in a senior role in government and government's relationship to the healthcare industry. And but it was beyond that, because I of course knew of Phil while he was in office in the Johnson administration. Medicare and Medicaid were, as I said, enacted and implemented when I was an intern and resident at Boston City Hospital. And I saw the tremendous effects the government policy could have on the practice of medicine. And that it was, a very important stimulus to me to actually become, really make health policy my career, which it has been in a variety of ways. And so he was very influential in that way.
So Dick, pivoting to you, you had the privilege of traveling with Phil and going to these meetings. Of his many qualities, can you name one that particularly stood out for you?
Well, it didn't take long for me to see how Phil had so much passion about policymaking. He was very good about following through on his newly found interest in healthcare, and was very helpful. I mean, the meeting we did in the Senate at the end of the regional meetings, Phil was able to bring all the representatives from health-related agencies, HICFA, CDC, to the table so tribes could interface with them. And it was very helpful and created some excitement, not to lose hope, some change can happen. And I think it did.
So on to Helene. What was it like to have Phil as an academic partner in your works?
I guess his most outstanding trait to me was that he was an incredible mentor. I recall the time that I was asked to give congressional testimony to the Senate Committee on Aging. And I was a lowly assistant professor of health policy. And I walked into Phil's office and I said, Phil, I'm just not really up to this right now. And he said, this is the golden opportunity for you. We are, after all, we are the Institute for Health Policy Studies. So when policymakers are asking us to give testimony, this is a marvelous opportunity to share what we know and learn in the hopes of making policy more responsive to what our data, our scientific data show. So I got on the plane, I went to DC, and my mother-in-law was so excited, she asked if she could come to Washington to hear me testify. And I didn't know who I would be more afraid of, my mother-in-law being there or the senators, but that's another story. Anyway, I got there and I gave my testimony, and it seemed to go very well. And I looked around, the visitors were always in back of the witnesses, and I looked around to see if my mother-in-law was there. And in fact, she was there. But importantly, so was Phil. He was there for me. He gave me the high five and a big smile. And I really know I speak for so many people when I say he was an extraordinary mentor. And he inspired the rest of us to be mentors.
That's such a great story. We're going to do one more round, and this is very open-ended. So anybody who wants to talk first can. Is there anything else you'd like to say about Phil?
Phil had two traits that I think are essential for being an effective leader in the health policy arena. One was passion. He was passionate about social justice, and he made that clear. And the second was that he was unafraid to say things that may or may not be politically correct or popular at the time. And third, and I think maybe most important, he had a great sense of irony. If you don't have a sense of humor and you're working in the American health policy arena, you're not going to last long. And I think he had all of those in abundance.
You want to say anything, Helene?
Yes, thank you. Thank you for giving us this open-ended opportunity, Steve. May Phil's memory be a blessing for all of us who are fortunate enough to have Phil in our lives.
Well, thanks to the three of you for sharing your reflections on how Phil made a difference on national health policy and the health of the nation. And thank you for your part also in making that happen.
Hi, I'm Joanne Lewis, former coordinator of the Black Caucus and one of the founders of the Black Caucus, which began shortly after the death of Martin Luther King. It was such a traumatic event for the few Blacks that were on the campus that we gathered together in an effort to continue some of Dr. King's legacy, and we just became a large group of people that met every Thursday to help bring about the changes that we thought were necessary at UC. So the group developed a list of demands, and shortly after Dr. Lee arrived on campus, we met with him to share those demands. Dr. Lee was very welcoming to the Black Caucus and familiar with the kind of changes that we wanted to make. And when he created the Affirmative Action Office, that was just really a triumph for so many people who wanted to increase the number of staff, who wanted to hold the faculty accountable for their behaviors. I believe that his time on campus was the beginning of so many good things, the way that chancellors were looked at, the way deans were appointed, the way that scholarships were identified. So yes, he was an enormous influence in so many ways, it's uncountable.
But second, I believe that the universities and a health sciences university has a unique contribution to make to the solution of many of these problems that seem so overwhelming today. And I think indeed that we will make those contributions. I think we are making them. I think our contributions in the future will be far more important to our society than they have been in the past.
My name is Lou Butler, and my relationship with Phil Lee goes back to when I was a teenager and with his family and his younger brother. And it was because of that relationship that we eventually, under his leadership, created the Institute for Health Policy. Starting in June of 1972, Phil stepped down as the chancellor. He'd found us a house on 3rd Avenue on a steep hill that we could have for our institute, and we set out to create it. So anyway, that was the beginning of the Institute. It was all due to Phil. It's gone on to be a great success, and happily it holds his name.
So this segment focuses on the Institute for Health Policy Studies. And as you just heard from Lou Butler, the original vision was to create a multidisciplinary center that had a community of scholars representing multiple disciplines from within UCSF, but then would collaborate with state and federal government, with community-based organizations, and the private sector. Its early focus was on health systems, population health, and clinical care. With us today to discuss the growth and the evolution of the Institute for Health Policy Studies are its second and third directors, Hal Luft and Claire Brindis, as well as the first Phillip R. Lee Fellow in Health Policy, Kim Rhodes. Hal, we're going to start with you. In 1978, what was then the Health Policy Program had won a major federal grant to address health policy and to do research. But the reviewers noted a significant absence in this otherwise diverse set of faculty, of whom I was one. There were no economists. You were at Stanford at the time, an institution rich with economist faculty. What did it take to get you to move to UCSF?
Very little. I was at Stanford. I had gone there from Harvard because I had trained in economics and health economics. And I was at an appointment in the medical school at Stanford because I wanted to be among physicians and others who are actually doing healthcare. But most of what I was doing was publishing in the peer-reviewed literature, doing good research. And then I met Phil and Lou Butler and Al Johnson and yourself, and saw that these were people who weren't just writing papers to go into the peer-reviewed literature to maybe be read by policymakers, but they were actually talking to them. They were interacting with people who are making decisions. I said, this is where I want to be. It was a no-brainer.
Claire, before Phil became the first Secretary of Health, Assistant Secretary of Health under President Johnson, he contributed to global health during his 1963-65 stint at the U.S. Agency for International Development. In fact, when he was there, he drafted the first U.S. policies for international family planning services, an issue that is still controversial. Given your rich career in reproductive health, how did you come to work with Phil 2 decades after his USAID experience?
I was very, very fortunate to meet Phil when I did, because he hired me for a 3-month stint at the Institute to write an extensive paper on a very important policy emerging issue, which was teenage pregnancy and pregnancy prevention. And little did I know that this initial 3-month period would lead to a lifelong opportunity to be a learner at the Institute and to become a health services researcher focused on reproductive health, health policy, and adolescent health. I think one aspect of this relationship that developed was how much we shared values, how I was so attracted to the fact that Phil was so committed to women's health and the role of women and the role of social equity, and he championed these issues long before they became part of our national agenda.
And Claire, you also created a fellowship named after Phil. You want to say a little bit about that?
In the 1980s, when we wanted to honor Phil for his contribution and his legacy, a small group of us, including Hal, of course, were very committed to renaming the Institute in his honor. And when I approached Phil about what he would like to have as part of his legacy, whether he wanted a chair in his honor, he immediately said no, he didn't want that to happen at all. He really wanted a fellowship set up so that there would be the next generation working in issues of health policy, and particularly he was committed to having underrepresented minorities as well as women learning those tools and those skills so that they could be at the cutting edge of doing and conducting meaningful health policy research. And so we were thrilled. After an extensive search, we were able to identify our first fellow, who we are immensely proud of, and that's Dr. Kim Rhodes.
Well, Kim, you couldn't better encapsulate Phil's vision. You've run a gamut of career interests, from basic science to clinical care as a colorectal surgeon, to health policy, to epidemiology, and the first Philly Fellow. You've since played a leadership role in the San Francisco Bay Area in COVID-19 and its impact on vulnerable populations. What persuaded you? Why did you want to become a Phillip R. Fellow?
So thank you so much for inviting me to be here. And I'm really honored to take part in paying tribute to Phil's legacy. So I actually first met Phil when I was selected as a California Endowment Scholar, Minority Health Policy at the Harvard School of Public Health. And I fell in love with health services research while I was there. And when I came back to UCSF to pursue a fellowship in colorectal surgery, I was desperately searching for where I could land the work that I had started at Harvard. And it was recommended that I look into the Institute for Health Policy Studies. And so being selected as the first fellow, I remember when I got the phone call, I felt very honored, very emotional and overwhelmed, because I really felt like what was being told to me was that someone or many folks saw the potential for me to make a contribution that was worthy of Phil's name. So I've continued down this path, and what I didn't realize in being named to the position was that I would have the opportunity to get direct mentorship from Phil. And that is something that I hold our little visits together, talking about research and talking about leadership, something that I hold very dear, and that motivates me to continue to try to make big impacts and not just publish papers.
So we have a chance now to just open it up and for people to share any other thoughts of what it was like to work with Phil and to know him. So whoever wants to go next.
Well, let me jump in for a moment on two very important lessons that Phil inculcated in me. One was how to become a trusted policy advisor. And that was really about making evidence and data of service to others, not necessarily building our own academic careers that was important. And I think that part of integrity and that part of those values that was so important in establishing the DNA of the Institute continues to shape the work that the Institute is involved in now throughout our campus. The second issue that I wanted to raise is when Phil, as a mentor, believed in you, it was incredibly important. And as a young Latina faculty member establishing my career, having Phil believe in me really helped me with creating my own sense of self-confidence, and that dreams could be pursued and that they could be achieved. Dreams I had never anticipated being within my reach. When Phil inspired you, we all aspired to the values and the standards that he held so dearly.
One of the things that really struck me on that very first introduction to the health policy program was Phil saying, I'm a liberal Democrat. My colleague here, Lou Butler, is a Republican, and he's a lawyer, and I'm a physician. And it became very clear that the notion is you bring together people with diverse opinions, diverse backgrounds, diverse political leanings, and you figure out how each of them can be part of it. Then when I started thinking about actually going forward with some proposals for healthcare reform, I didn't start out with what is the ideal system that Hal Luft would make. I started with a Phil notion of how can you bring different people to the table, have nobody felt like she or he is being excluded, and then structure it so they're working towards something that's much better than any of them would have wanted or thought about, and been willing to say, yes, that's exactly what I want. No, it's a process. And Phil was all about process.
Kim, want to add anything?
Just to emphasize the importance of getting different opinions around the table and understanding, sort of being able to find your blind spots because there are other opinions at the table, so critical to creating something that has a potentially positive impact on the greater society.
And in turn now, Kim, what I see you and as the next generation of leaders is very much how you're mentoring the next generation. So Phil's commitments to all of us continues to have a rippling effect and a long-term legacy that continues to shape the kind of research that you're conducting, the kind of impact that you're having. And so many of the programs and vision that Phil had, whether it was reproductive health, whether it was healthcare reform, whether it was HIV, these are the seedlings that he nurtured and supported and now continue to blossom because They require each of our generations to be contributing to solving these very complex problems.
Thank you all so much.
My goal as a mentor is to support people being who they are, not trying to recreate myself through these. And this group of fellows that I've had over the years, they are one of my major sources of advice.
When I first met Phil in 1979, spring quarter, the last quarter of my human biology degree at Stanford, when I took an elective in health policy. And I just was enchanted. I had been a kind of, let's say, a closet medical student and thought I wanted to do something different than just being a full-time clinician. And that course inspired me to think bigger. And at the end of that course, after talking with Phil a couple of times outside of class, he invited me to apply to be an intern at the Institute for Health Policy Studies. I guess what I want to focus on is when I think about Phil, the things that come to mind most acutely are his incredible mentorship. And here he was willing, having done all that he had done in Washington, D.C. and being chancellor and his role in starting the Institute, to take a kid from the Central Valley of California and introduce him to health policy. And even though I didn't do health policy maybe in the way that many people at the Institute did, it shaped even how I focused on HIV prevention research with a goal to do impactful work at a population level. And over the years, since then, I've kept in close contact with Phil and also became friends with Roz, and that became part of my my itinerary when I would go to New York, was to visit Phil and Roz and to hear Phil's reflections on where we were heading, where we had been as a nation in terms of health policy and politics. And probably just to end my comments, I think one of the more memorable visits I had with Phil in New York was one time where he was, it seemed like he might be developing a pneumonia. Roz needed to step out. He needed to sleep, and I stayed with him in his room, looking up while he slept at the photos of him signing the Medicare Legislation Act with LBJ, and it filled my heart with appreciation. So Phil opened the doors for so many people like me, and it wasn't just kind of a short-term mentorship, it was a lifelong mentorship. And I feel forever grateful. So thank you, and be well, Phil.
This segment will cover Phil's contributions to health in San Francisco. After his first stint as Assistant Secretary of Health, Phil came to UCSF, first as its third chancellor, and then with the establishment of the health policy program 5 decades ago. It's now known, of course, as the Phil Institute for Health Policy Studies. But while at UCSF, Phil also had an important impact on health in San Francisco, serving as its first health commissioner. With us to reflect on Phil's influence in that role are 3 legendary former directors of public health in San Francisco, Merv Silverman, David Werdiger, and Sandra Hernandez. They are part of a legacy of strong San Francisco health leadership that has continued to this day, as exemplified by the county's noteworthy performance during this tragic COVID epidemic. And start with Merv. Merv, you led the health department during the height of the HIV/AIDS epidemic. Seems like it was just yesterday. and then later led a national program based on the San Francisco model. How did Phil figure in that?
Well, it's interesting, Steve. It was a little over 4 decades ago that I came to San Francisco from Kansas to become the director of health. And shortly after I got here, I remember seeing a postcard that showed Dorothy and Toto from, The Wizard of Oz superimposed on a leather bar. And the thing at the bottom said, Toto, I have a feeling we're not in Kansas anymore. So right after I got here, I set up an advisory committee, an informal advisory committee, and Phil was part of that. And he was also there on the other end of the phone when I had a problem and needed to get some clarification. When I left the department, Phil asked me to direct the Robert Wood Johnson Foundation AIDS Health Services Program. So he served as my boss. At about the same time, we were both board members of AMFAR, the Foundation for AIDS Research. So we were colleagues right there. So what it comes down to is over the years, he was a mentor, he was a boss, he was a colleague, but most importantly, he was a friend.
Wow, that's quite a statement. We're going to get a chance to hear from you later, but now we're going to turn to David, who has had so many leadership roles at UCSF, Fresno, and the San Francisco Health Department. David, what was it like working with Phil?
Phil was what I would call a straight arrow kind of guy. He really had a strong moral compass. He would be indignant when there was injustice of any sort. He had a fundamental faith, I would say, in the democratic political process. And that was apparent even at commission meetings, the way they were conducted. Everybody had their say. They may have only 2 minutes at the microphone, but everyone had their say, and Phil was always fair. And in a turbulent time, after all, we had an AIDS epidemic, we had a crack cocaine epidemic, we had all kinds of healthcare problems going on, and yet the issues would be brought to the fore at the bi-weekly commission meetings. And there, everybody had their say, and Phil would listen, and they all knew that they had an appreciative ear, that what they said would be listened to no matter what. And that allowed us to get through, I think, a very difficult time in a remarkable way.
Let's pivot to you, Sandra. Sandra, you've also had an amazing string of leadership roles. In addition to being health director in San Francisco, you led the San Francisco Foundation and now the California Healthcare Foundation. And while you were health director, you co-chaired San Francisco's Universal Healthcare Council that led to the pioneering Healthy San Francisco project. Share with us your experience in working with Phil and how that influenced that program.
Sure, Steve, I'm happy to do that. I came to UCSF as a resident in '84, and I was in primary care, and I had a patient who had polycystic kidney disease in my continuity clinic. And at the time, there was a policy at the health department that we wouldn't dialyze individuals if they were undocumented. And I was disturbed by that as a policy. And that's when I learned there was a thing called the Health Commission. And I asked one of the faculty members, how do I appeal this policy? And they said, there's a commission. And so one day post-call in Scrubs, I went and signed up for public comment. And there was the iconic Dr. Phil Lee, who was chairing the commission, and Dr. Werdiger, who was the director of health. And in public comment, I was a bit righteous, and I had the policy, which was badly outdated. I don't think anybody really even knew it existed. And I made my case in under 3 minutes in public comment. And Dr. Lee, who, I was a bit intimidated by, I knew his reputation. I'd heard a lecture from him as a resident. He asked Dave to look at the policy, and that was really the beginning of my career in health policy. And then, of course, later when I became director of health, having been at the AIDS office, again, working under Dave, Phil was just an incredible mentor, but really an extraordinary leader, mainly not only was he soft-spoken and he had this amazing career, but he always held at the center this notion of health equity and racial equity, something that, of course, we're talking about again today. When we did the universal health care effort, that was our third try in San Francisco. We had done it a number of times before we actually got it passed. And Phil was very interested in who was sitting at the table and how we would get it into legislation. And so, Phil brought a ton of experience in health policy to San Francisco that I think all of us on screen today have numerous stories by which we could give testimony to that.
And Merv, we'll pivot back to you. You worked with Phil using the San Francisco model of AIDS care to disseminate that nationally, funded by the Robert Wood Johnson Foundation. How good did that make you feel, and how helpful was Phil in helping you to carry that out?
Well, as I say, at that point, he was my boss, which was a different relationship. But he was the kind of boss that would let you go and do what you needed to do, comment when he thought there may be a problem, but really, and it's the thing that I think has been said here time and again, whether it's listening to a 2-minute presentation at the commission or you're sitting down with him at the desk like Sandra was or what I was, he never talked down to you. He talked to you as an equal, and he was always there when I needed him for backstopping. And I think the Robert Wood Johnson Foundation, which of course you're so familiar with, really did a great job in taking the San Francisco model, which was an outpatient emphasis model of care from the beginning to end, from testing to, sadly, to death, but providing in-home services, every kind of service you need, was really unique. And I think Robert Wood Johnson and them coming to Phil and then Phil coming to me allowed us to make San Francisco really a model for the country and for the world.
Well, it's clear that not only did the three of you benefit personally and professionally from your association with Phil, but the city and county of San Francisco did as well. In the few minutes we have left, would anyone else like to share comments, thoughts about Phil, his values, his impact on you or on the world?
Steve, if I could just add, one of the other important contributions, I think, and it really does make San Francisco a unique place, has been this long-term relationship between UCSF and the Department of Public Health. Mm-hmm. And Phil and David were both very good examples of the ways in which those two units work together in a very collective fashion, from academic to research, to teaching, to policy. And I think as you think about the way San Francisco today has responded to this COVID pandemic, it really does build on the legacy of the interrelationship of those two important organizations. And the governance that Phil set forth for that commission really did set a standard for how a health department and an academic institution of the stature of UCSF could work hand in hand to address major public health crises that the city has faced.
Well, it's clear to me how fortunate San Francisco was to have the three of you working for its health, and how fortunate you all were to have Phil as your leader and inspiration. And what a blessed time. And let's hope some of those inspirations can carry forward as we move into our latest set of crises. Thank you all so much for what you did and for what you are.
Hello, this is Paul Lee, and I'm here with my sisters, Amy and Margie. And we have a few stories that we'd like to share with you about our dad.
When we were kids, I was horse crazy, nutso cuckoo. And I loved to jump and I loved to compete. And Dad encouraged me in all of this. He came to my competitions when he could, and he cheered me. He gave me high fives when I won, and he consoled me when I lost. But he was there for me 100% of the way. I never knew something that I found out as an adult, which is my dad hated my jumping, thought I was going to die every time, and it scared the hell out of him. But he showed up for me anyhow. He supported me in my passion. And that is my dad and how he was for all of us, there for us, 100%.
Absolutely. In life, we come from family. We go out into the world, and if we're lucky and we work hard, as Dad did and was, you get to make a difference. At the end of life, it is a natural cycle to return to thoughts and memories of family. One way this manifested for our father was in the creation of collages with Paul, Margie, and me. Dad would have a dream or begin to think about a season of his life, or maybe a sibling. He would send us kids out into the family archives to dig up material. We would bring that back. He would mull on his memories. The next visit, we would bring canvas, glue, photos, ephemera, and we would make a collage with Dad. Dad choosing the placement of every photo. When Dad died, he had 17 collages surrounding him on the walls of his rooms.
We knew that Dad was amazing in his life, but one thing we never knew until the end was that he was an artist. And he shared that with us, and that was amazing.
I'm Dusky Estes, and Dr. Phil Lee was my stepfather. And I'm also the daughter of Carol Estes, also of UCSF. Phil was a dad to me and a mentor to so many. He taught us to leave this world a better place. He taught us that education is power and laughter is medicine. I laughed with him every single day. When we drove across country together, stopping in every state for a Dairy Queen blizzard with only one tape, we were quite a duo to behold, belting out at the top of our lungs some Tracy Chapman lyrics that still resonate today. Finally, the tables are starting to turn, talking about a revolution. While they're standing in the welfare lines, crying at the doors of those armies of salvation, wasting time in the unemployment lines, talking about a revolution. I miss him every day, and I try to live up to those big shoes in my food justice work with Farm to Pantry and my ethical purchasing with Black Pig Meat Co., making sure everyone has access to good food and supporting only those farmers who care for the animals and the earth, knowing it's their responsibility to save it for the generations to come. He would want us all to continue to be the revolution in ways both quiet and loud. Thank you.
My husband, Phil, lived a long, happy, and extremely fulfilling life, continuously involved in work he loved, making such a difference for others through that work, having so many meaningful and long-standing relationships which span generations, and knowing what love really means in both the giving and the receiving. During our decades together, we spoke often about what, in his nature and approach to life, made it possible for him to get so much out of life and to give so much back. That's what I'd like to share with you today. Phil often said that while some of his father's attributes helped him in his professional life, the human qualities he valued most in himself and sought to strengthen and develop came from his mother. Those are the qualities I cherished most in him, and that's what initially brought us together. Phil cared more about human relationships than almost anyone I've ever known. I'm not talking here about professional and political relationships, which he certainly had, but of deep personal relationships. Phil loved people, especially those who came from backgrounds that differed from his own. He wanted to understand what it was like to live their lives, and he was constantly learning from their experiences, applying what he learned to his own work and life. I think that empathy was the basis for his openness and commitment to social justice, and was also the basis for his unique approach to mentoring. Rather than seeing mentees as the next generation, to carry on his own work, Phil sought to learn what his mentees were passionate about, how their passions could be nurtured and supported, and by doing so, how in their very own way they could make the world a better place. Phil was one of the most nurturing human beings I've ever met, a very unusual quality in a man. A bench I recently endowed in the ancient playground in Central Park in New York City continues this legacy. Under Phil's name and dates, the plaque reads, "Sit here and be nurtured by a passionate advocate for social justice and health." I go there almost every day. Over the decades we were together, Phil and I learned a lot about love, and that journey was one of the most transformative experiences of our lives. As our caring and commitment to each other deepened over time, Phil pointed out something that was initially surprising to me, that love is not a zero-sum game. He said that having a profound love doesn't shut others out. Quite the contrary, he said. The ability to love one person deeply expands our ability to love others. Another of Phil's attributes that enabled him to live so long and get so much out of life was his incredible adaptability. Phil didn't face many hardships as a child, except for a bout of polio. But later in life, he intentionally exposed himself to challenges, such as when he volunteered to serve in the Korean War or accepted multiple positions for which he had little prior experience. By doing so, Phil learned how to adjust to new and difficult situations, providing, of course, that there was always a couch available on which to take his world-class naps. As Phil adjusted to these new circumstances, he allowed his ideas and assumptions to be challenged and changed by what he was experiencing. And then he applied what he had learned to whatever he did next. For example, he repeatedly told me that his work desegregating the hospitals under President Johnson is what enabled him to be able to really appreciate what he heard from members of the Black Caucus when he later became Chancellor of UCSF. Phil's adaptability, along with his breadth of interests and great capacity for laughter and joy, is what enabled him not only to face the challenges of aging and the pandemic, but to continue to thrive and grow. The impairments he experienced over the last 5 years clearly made life more difficult. Yet, with adaptation, some aspects of his life actually became better. He was able to engage his broad interests in Shakespeare, art history, and music, not only listening to concerts, but singing at Carnegie Hall. He created many amazing collages with his daughters, Amy and Margie. When visual problems prevented him from reading, I spent hours each day reading to him. Thousands and thousands of pages of history, biography, fiction, which both of us enjoyed much more than we would have by reading on our own. Each book stimulated Phil to think and talk about his past, to explore how his past experiences contributed to who he had become, and how history relates to what our country and the world has become. I'd like to share just one more thought of Phil's, this one related to memorials and tributes like the one we're celebrating today. Phil repeatedly told me how lucky he was to hear how people felt about him at the naming event for UCSF's Health Policy Institute in 2007. But recognizing that the dead are not present at their own funerals and memorials, he said to me, and I now say to you, always let the people you love and care about know how you feel about them, often and while they're still alive. Thank you.
For many of us, there's a moment that changes our lives forever. For me, that moment was in 1973 in a medical school classroom at UCSF when I first heard Professor Phil Lee lecturing about how the U.S. spent considerably more on health care than other industrialized countries. But our outcomes were no better, and in some cases, worse. It was a revelation. Here I was, studying to become a doctor, and I learned for the first time that in medicine, we often focused on the wrong things. That moment stayed with me. Months later, when I was sitting with an advisor in the dean's office, wondering about whether medicine was even right for me, my somewhat exasperated advisor exclaimed, "There must have been something or someone that excited you." To which I responded that there was this lecture by Professor Lee that I found particularly fascinating. That advisor promptly arranged for me to meet with Professor Lee. When I met with Phil, he did for me what he did for countless others. He turned on the light. Literally, one week I felt like I was in a darkened room with no discernible path forward. And the next week, my mind was aglow with exciting possibilities uniquely suited to me. Phil showed me I could have a bigger and greater impact on my community. Instead of caring for only individuals, I could help take care of whole populations of people, which is what we try to do today. Phil was indeed that light man for many of us. He challenged us to think bigger, and he pushed us to enlarge our view. It was not always comfortable. Sometimes I'd meet with Phil when I thought I had a great idea, and I'd leave the meeting with a headache. But I always grew. Phil taught us not to be discouraged, and he nurtured many of us for a lifetime. How many of us, long after we left UCSF, continued to call him or email him or visit with him and to be shepherded and encouraged by him? Back in 2006, I visited with Phil in his home in Palo Alto to pick his brain about a lecture I was giving on the requisites of great leadership. I enunciated 5 core attributes, and it was the 5th one that appeared to excite Phil the most: a reservoir of faith. He leapt up from his chair. Phil said that most people don't appreciate the degree to which great leaders are advantaged by their faith. It was faith that drove Phil to believe that you have got to be in Washington pushing, even when the odds are against you. Faith is what gave Phil courage, and courage is what Phil gave so many of us. Yes, Phil helped us chart our courses and nurtured us throughout the journey. He understood the imperative to nurture others so that when the baton was passed on, they would be prepared. But Phil's greatest gift to us was the example of how he lived his life, the values he embodied, the causes he championed, and the actions he took. Think about how many times you have asked, how would Phil feel about this? Would Phil think this is right? Especially today, as we address rampant racial, social, and health inequality, we remember Phil. We are leading our communities to take action, inspired by the example of Phil's courage and commitment to equality and justice back in the 60s, as he helped to dismantle segregation and eliminate discrimination in hospitals in the South and right here at UCSF. Fortunately, Phil's enduring light still shines brightly through us, Phil's family of former students, colleagues, friends, and relatives. We have been privileged to spend time with one of the most extraordinary humanitarians of our lifetime. That legacy lives on through the vibrancy of the institute that was named in his honor. Phil was a man of compassion and unparalleled generosity, who was unwaveringly dedicated to excellence, to doing the right thing, and to improving the lives of people in the communities we serve. Following Phil's example, we now inspire others to aim high, think big, break barriers, always with the intent of doing good. Thank you, Phil.
When it's all over, what will he once said about himself?
Well, I guess he cared more than anything for patients, for family, for the community.